Hello, this is Dr. Dennis McKenna. I'm joined by Dr. Fred Venditti, our hospital system general director. Today is day 44, Incident Command, giving you the update from Albany Medical Center on the coronavirus. We can report in the 5 counties, Albany, Schenectady, Rensselaer, Saratoga, and Columbia, there are 1,618 cases that have been positive for COVID-19. That's an increase of about 100 from yesterday. That's about a 5% growth. Inside here in the medical center, we have some good news. The number of cases of patients in the house that are positive for COVID-19 is 60. Yesterday, that was 63. We had a net decrease of 3 because we had 6 discharged and we had 3 admissions. And that's good news. The breakdown is we have 33 on the floor, 27 in the ICU, and 22 of them are still on ventilators. Antibody testing. We've talked recently about antibody testing in the community. You may have read in the press that there are 2 pop-up sites of antibody testing at some local supermarkets. This is a good opportunity to remind us when we're going to be doing antibody testing. And Fred, I think you have some information.
Yes, Dennis. So the state's doing about 3,000 people in their pop-up sites around the community, really around the whole state. We're very close to being able to do testing here at the medical center. We're waiting for the FDA to approve the specific test we want to use, which is also going to be used by several of the other hospitals, so we'll all be on the same platform. Keep your fingers crossed. Hopefully within the next week we'll be doing things.
I know this is something that a lot of people are anxious about, so we're looking forward to doing that. When we think about antibodies, we also think about convalescent plasma, and I think also we have an update there on the number of cases that we've been able to transfuse.
So Dennis, we've infused 15 patients, just a phenomenal number. I think we have 4 more teed up for the next day or 2. So it's working well. As we said yesterday, one of our ECMO patients received convalescent plasma and was off that machine. So it really is quite helpful.
Great. A couple other quick items to update on before we get to some of the broader topics. We've talked in the past about moving IV pumps outside the room. If the pumps are outside the room, that gives the nurses the opportunity to adjust the pumps and the medications that go in it without going in the room, which obviously will use more PPE. We actually now have a couple cases, 2 I believe, where we have the ventilator outside the room, and our respiratory therapists are able to safely make adjustments to that, still see the patient, look at their breathing mechanics, again, outside the room. This is something that's been done at other academic medical centers.
Absolutely, Dennis. This is terrific. And if you've ever been in our intensive care units, which I know you have and I have, it's all glass. So you can see everything that's going on in the room, so you really don't need to go into the room. The patient's sedated, typically. So if you can manipulate the ventilator and other machinery outside the room, that's less traffic in and out, less PPE, less opportunity for the virus to do things.
So always looking for new ways to do things better. Another thing that we started last week was the ability for our workforce to pick up their prescription medications at our outpatient pharmacy location through a drive-through. We piloted that. It was very successful. We're going to continue that this week on Tuesday, Wednesday, Thursday. If you're an employee, you call 262-MEDS, that's MEDS, and schedule the time of your pickup. And that sounds like that's been very well received by our workforce as well.
It has. It's a great perk for them. It's working well.
So speaking of members of our workforce, let's talk about healthcare workers who have tested positive for COVID-19. This is a topic that we take very seriously, and obviously the PPE that we wear is meant to protect them, and we look at the data all the time. So Fred's going to give us an update on that data.
So as of today, Dennis, we have 88 healthcare workers who've tested positive. Now, to put that in context, we've actually tested 772 of our staff. So it's about a 12% positive rate in those employees that we've tested. Half of them are actually cleared already to come back to work.
Wow.
And I was just walking through the MICU and I saw one of our attending critical care physicians who tested positive, and he's back to work. He looks great. Again, 2/3 of our employees contracted the virus in the community, not here in the hospital. So about 30 have contracted the virus through a contact here in the hospital. And that's really held up since we've been talking about this.
And the reason we know whether or not it was here or in the community is our infection preventionists will actually investigate every single one of these cases.
Absolutely.
And try to figure out how that occurs.
They do contact tracing, which you probably have heard about in the news. And so they actually talk to the individual and backtrack to see who they were exposed to determine where perhaps they were, where they contracted the virus.
So we'll continue to update all of you as we go forward on the number of healthcare workers that are positive for COVID-19. But I think ultimately we're very impressed and proud of our workforce. That number is actually quite low compared to what that number is reported at other institutions.
It is, Dennis. It is very low compared to other institutions of our size.
The last item that we wanted to talk about was numbers and modeling. I've mentioned in the past that Fred and I both are number geeks, and we love to look at statistical models. And we've tried to model out what we would expect to see in the number of cases of COVID-19 in the hospital here. Recently in the newspaper, there was some discussion about a local university that was doing its own modeling. And we were very interested in their study, so Fred reached out to the author of that paper.
So I reached out yesterday, had an hour-long conversation with Dr. Malachi Ishmael, I think I'm pronouncing that correctly, who's a professor of computer science at RPI. And he has developed a model that uses machine learning and a whole bunch of very sophisticated algorithms that frankly are beyond me to explain to you. But he's projecting the total infection rate, and that's important to understand. So it includes people who are hospitalized, people who are positive and not hospitalized, and people who are asymptomatic and have the disease as well. So after some discussion with him, we agreed we were going to give him some of the hospital data that we have from us and some of the other local hospitals, and he's going to try to use that data to model hospitalization rates using his same algorithms.
So a model is only as good as the data that goes into it.
That's right.
He had access to certain information, but he didn't have access to our data or the regional hospitals. You coordinated getting all that data to him so he can rerun the model.
That's right. He should have that data by this afternoon, late this afternoon, and then hopefully in a few days we'll see what the model tells us.
And this will help inform our decisions and decisions for the region as well.
We're all looking to the future, and when I say future, a week from now, 2 weeks from now, 3 weeks from now, in terms of where we're going to be, so that we plan and can care for those patients that need our services.
And speaking of planning for the future, we know that the governor today in his press conference talked about a next phase, allowing elective surgeries to turn on in various parts of the state. We are watching that very carefully, and we're certainly anxious for those surgeries that we would like to see happen for the patients to occur soon. We think we'll be able to come back tomorrow. There could be an executive order. We'll definitely be talking about that tomorrow.
Yes, he mentioned it at his press conference, but I think we really need to see the detail of what he's proposing.
All right, so we'll talk about that tomorrow. Fred, as they say, who are you wearing today?
Well, I'm just wearing a generic AMC jacket. It's our understanding that some people are very interested in our wardrobe and have made comments. So I hope the fact that we're wearing generic jackets today is not offensive to anyone out there, and they still enjoy our change of wardrobe.
Well, I wore mine on purpose. So I wore mine because I have this new purple tie today from my wife. It has a penguin on it. I love purple ties and I love penguins, so it's the perfect tie. But it was a perfect chance for me to wear an Albany Med jacket to talk about members of our workforce who we have not highlighted yet. And those are our advanced practice providers, physician assistants and nurse practitioners who are on the front line helping care for COVID-19 patients and others. An incredible part of our workforce. In particular, there's one, Patty Ells, who's a nurse practitioner. She also works on our palliative care team. And we talked about palliative care last week.
We did. A very, very important service right now with a lot of sick patients. Again, as I said, shepherding families through very difficult decisions. Patty is so very important in that process.
She is, as are all the other physician assistants and nurse practitioners that we work with, and hopefully we can call out some of the other ones in the future as well. Finally, who doesn't love a parade? Everyone loves a parade.
I love a parade.
We saw a parade today. It was fabulous. It came by the medical center. It was led by Albany Police. It was led by the fire department, and the town of Schodack was leading that parade. Many members of our workforce came outside. They were socially distanced. They're wearing a mask, but they were able to, I think, appreciate the outpouring of support from the community. It was really nice.
It was
really nice. So thank you to all those who helped organize that. So we'll be back tomorrow. Again, we're going to focus on the elective surgeries. That's it for today. As always, we ask you all to please take care of yourself, take care of each other, and we'll see you tomorrow.